For the second year in a row, the French Bulldog is the most popular dog breed in America. This according to a press release by the AKC earlier this month. But did you know that despite their popularity, French Bulldogs are in fact widely considered to be the single most unhealthy dog breed in America, oftentimes costing their owners multiple thousands of dollars in veterinary bills. Do you know why that is though? Well, in this video, I'm going to explain some of the more important and common health problems facing the French Bulldog breed, and I'll break this down by major systems of the body. We'll start with the respiratory system, then my specialty, the nervous system, then I'll cover the gastrointestinal systems, as well as some miscellaneous areas that I think warrant mentioning as well. I can't cover every single health problem in this video, but these will be the major ones and the ones I think impact their welfare the most. If you've heard the terms brachycephalic, BOAS, IVDD, etc., and you're not sure what these terms mean, then this is the video for you. If you're thinking about purchasing a French Bulldog and you're not sure who to believe in regards to all the health problems you've read about online, this video is also for you. Quick disclaimer here, please make no mistake, this video is not me hating or making fun of these animals. I see French Bulldogs in my practice on a near daily basis, and I do everything in my power to try and help them live pain-free and mobile lives to the best of my ability, like any other patient that I see. I take my job very seriously. I want these dogs to be healthier than they currently are, and I want things to change about them so I see them less. First guys, please, if you don't mind, hit that like and subscribe button, help me get this message out to as many people as possible, grow the channel, grow the video. Now let's get into it. Part 1, the respiratory system. French Bulldogs have a skull and muzzle that is described as brachycephalic. Brachycephaly is a term used to describe the skull shape of an animal. Dogs have 3 main skull shapes: dolichocephalic, mesocephalic, and brachycephalic. Dolichocephalic dogs have an elongated muzzle. These are breeds like, say, a collie. Mesocephalic dogs are more moderate in this regard. Take your run-of-the-mill Labrador Retriever, for instance, and many other breeds. Brachycephalic dogs and cats have a shorter muzzle and more broad, flattened skull shape. These are breeds like boxers, for example, what I like to call lightly brachycephalic. Then there are the extreme brachycephalic breeds, like French Bulldogs, English Bulldogs, Pugs, Boston Terriers, and more. Their muzzles are oftentimes non-existent and their faces are completely flattened. An important point that I want to make here is that brachycephaly is not something that occurs in wild dogs or wolves, to my knowledge at least. This skull shape is the result of a combination of domestication and artificial selection, i.e. breeding, for this shape. French Bulldogs originated from an ancestral type of bulldog bred to pin down bulls in a thankfully long gone blood sport called bull baiting. As the years passed, these extreme brachycephalic features were then sought after because these features invoke an emotional response in the human brain that is similar to when we look at a newborn human baby. Things like bulging cheeks, large eyes, and large forehead. Eerily similar, don't you think? So French Bulldogs are considered an extremely brachycephalic breed. These extreme features have an enormous consequence on a dog's respiratory system. This may come as a surprise to you, but as it turns out, dogs actually need their nose. I know. Shocking, right? You see, for a dog to both breathe and regulate their body temperature normally, they need air to flow without turbulence through their nose and down into their lungs. When extremely brachycephalic dogs have their muzzles panini pressed inward, all of that bony cartilaginous tissue inside the muzzle and the skull gets smashed together. Meanwhile, the soft tissues don't scale down in size appropriately. The end result is that air cannot flow through this structure now, or if it can, it does so with severe turbulence. This air turbulence is the source of the snorting noise many of these dogs make when trying to breathe, too often viewed as cute or normal for the breed when it's anything but. See this dog here? It's not smiling. It's trying to use as much force as it can to suck air in because air isn't getting through its lungs without that extra exertion. Oftentimes the nostrils are narrowed or stenotic to begin with, so air can't even make it in to start. A great summary of all the affected upper airway structures in extreme brachycephalic dogs like Frenchies can be seen right here, courtesy of the University of Cambridge. This entire spectrum of altered respiration is referred to as brachycephalic obstructive airway syndrome, or BOAS. I could probably do an entire video on BOAS, and I probably will sometime soon, but as you can imagine, BOAS has enormous consequences to a dog's well-being. Imagine living your life with your nose pinched closed and your only source of air being a straw in your mouth, and you kind of get the idea. It's also a progressive condition. It gets worse with time, and oftentimes it doesn't show up until middle age in some dogs. This condition puts these dogs at risk for life-threatening complications like pneumonia, anesthetic death, and oftentimes massively complicates these dogs when they come into the clinic for completely separate problems. A good example, and one that I see all the time, are French Bulldogs presenting for back pain, whereby the pain itself causes them to go into what's called an airway crisis. They get so worked up that they can't get enough oxygen in. Then that causes even more stress. Then they get less oxygen, and before you know it, we're having to use oxygen cages or intubate them just so they don't actually die from suffocating on their own anatomy. Ask any ER vet, they see this scenario all the time. It's estimated that around 50% of French and English Bulldogs and Pugs have clinically significant BOAs, but some estimates are much higher than that. It's hard to know exactly what the percentage is, but what we do know is that breeding for these extreme features predisposes for this issue. A study in 2015 from the Royal Vet College in the UK looked at facial conformation and the risk of this BOAS condition. They looked separately at two groups of dogs, one consisting of 700 dogs representing all sorts of breeds coming into the Royal Vet College Hospital for various problems, and a second consisting of brachycephalic only dogs. In both groups, they found that BOAS risk increases sharply in a nonlinear manner as relative muzzle length shortens. BOAS only occurred in dogs whose muzzles comprised less than half of their cranial lengths. Now contrast data such as this to the French Bulldog breed standard, the language which, in my mind, clearly lays out a recipe for the skull and facial features shown to place these dogs at risk of this BOAS condition. The condition really affects their welfare, and about half conservatively of all French Bulldogs have it to some degree. Part 2. The nervous system. To start with, let me direct you back to the breed standard, which calls for the French Bulldog to have a straight or a screw tail. Seemingly innocuous little trait, but how exactly did this breed develop a corkscrew tail? A study published in 2018 out of the University of Bern noticed that French Bulldogs, along with English Bulldogs and Boston Terriers, are unique among the brachycephalic breeds in that they also have a screw tail. They found the reason for this in large part is due to a genetic mutation in a gene called disheveled 2. This gene is responsible, basically, for normal spinal column development. When a mutation in this gene occurs, the spinal column develops all sorts of odd angles and misshapen vertebrae. The end result is a spine that resembles more of a mountaintop or kyphosis than a flat plane when viewed from the side of an x-ray. You also see these little wedge vertebrae, butterfly vertebrae, all sorts of little malformations of what should be a basically normal looking square to rectangle type structure. This disheveled 2 variant has been shown to be essentially fixed in French Bulldogs, as in every French Bulldog tested in this study was homozygous for this change. And the same thing for English Bulldogs and for about 94% of Boston Terriers. Another study in 2020 from the University of Helsinki also found this variant fixed in French Bulldogs. In humans, Robinow syndrome is considered a serious genetic disease with all sorts of consequences and impacts on a person's quality of life. I'm not sure I can show you the images of people with this disorder in this video, but feel free to Google search it for yourself and you'll see what I'm referring to. I would assert to you, the viewer, that based on these two studies, French and English Bulldogs are essentially dogs with Robinow syndrome. And for some reason, this is considered normal. But the neurologic problems certainly don't end with Robinow syndrome. You've probably heard of a condition called IVDD, which stands for intervertebral disc disease. This is the most common thing that I see French Bulldogs for as a neurologist. The vast majority of French Bulldogs, over 90%, suffer from this disease. Here's a summary. The intervertebral discs are little cushions that sit in between the vertebral bodies of the spinal column and provide it flexibility, just like people. Frenchies and other breeds that suffer from IVDD have premature degeneration of these discs, and this sometimes starts as early in life as a few months of age. In Frenchies, this disease is frequently quite devastating because dogs with IVDD are prone to IVDH, which is a herniated disc or herniation event. A herniated disc in a French Bulldog oftentimes requires multiple thousands of dollars to diagnose and treat, requires a huge amount of post-operative care in hospital and at home, and is a huge emotional toll for their owners. Here are some key takeaways that I want you to remember for French Bulldog IVDD. French Bulldogs tend to have a worse outcome compared to other breeds like Dachshunds with this condition. They more often wind up permanently paralyzed, and they more often suffer fatal complications such as myelomalacia. Myelomalacia is a complication from a herniated disc whereby the spinal cord will liquefy, yes, liquefy, after the injury from the herniated disc, and this liquefaction goes up and down from the injury to include the entire nervous system, and dogs die from respiratory arrest. It is awful. The reason French Bulldogs have IVDD in the first place, and by extension are prone to herniating a disc, is because they have a mutation called chondrodystrophy, or CDDY. Data compiled by UC Davis has tested over 1,000 French Bulldogs, and so far they found an allele frequency of over 90% of their tested animals. These two genetic variants, disheveled 2 and chondrodystrophy, are present in almost all French Bulldogs. One mutation malforms the spine, and the other causes spine-wide degeneration and huge risk of disc herniation. These changes are how, in large part, we've gotten from a wolf to a French Bulldog. This is how you make a French Bulldog. Now, this next point I want to make is extremely important, so please listen. Neither one of these mutations or conditions are currently listed in the recommended health testing on the Breed Club website or within the Canine Health Info Center, or CHIC, list of health tests for this breed. My suspicion as to why it's not is because these problems are so ubiquitous in this breed that it's kind of pointless in trying to test them out anyway. So let's back up for a second. Tell me again, how is a prospective French Bulldog buyer supposed to do their research, as they say, when the Breed Club itself doesn't even list the most common and life-altering problems like BOAS, spinal malformations, and chondrodystrophy? I got news for you guys. Frenchies are not coming into the ER dying from a loose kneecap. All right, guys, now we talked about the respiratory system and the nervous system. Let's talk about some other systems that are very, very, very commonly affected with French Bulldogs. Now, to start with, Frenchies, like Bulldogs and other brachycephalic breeds, are designed to have a jaw with a significant underbite. The medical term for this is prognathism or pronathism. I honestly forgot how to pronounce it. This is not considered normal anatomy by any means, but apparently in Bulldogs, perfection. Now, this conformation leads to pretty significant dental malocclusions whereby the teeth will poke into the gums every time they close their mouth. That probably doesn't feel good. And you can look inside a Bulldog or a French Bulldog's mouth and see that their teeth are oftentimes just completely overcrowded. It's a complete dental mess. Now, moving down the GI tract, we quickly arrive in the esophagus and the stomach. Now, remember before I mentioned how these dogs constantly have to suck in air as hard as possible to meet their oxygen demands. Well, turns out that has serious consequences on the GI tract. The respiratory tract and the GI tract are really intertwined in that way. French Bulldogs very commonly develop chronic inflammation in their esophagus, as well as hiatal hernias. Hiatal hernia is when the stomach basically involutes back up the esophagus. This is very painful. Both of these can and do cause chronic regurgitation and vomiting, which then in turn increases the risk of aspiration pneumonia and is just really uncomfortable in general. Ask anybody with chronic esophagitis or GERD or a hiatal hernia, and they'll tell you how painful it can be. One thing I wanted to mention that a lot of people actually don't know about is that brachycephalic dogs oftentimes will develop a mucus secretion into their middle ear, or what's called the tympanic bulla. Now, normally this fluid, which is produced by your middle ear all the time in a more kind of reasonably shaped dog, this fluid drains out their ear and down their eustachian tube and doesn't fill up. But in brachycephalic dogs, their head conformation causes this drainage to be decreased. So the mucus just builds up inside the middle ear cavity. We oftentimes see this incidentally on an MRI when we're scanning dogs for other things. Now, we know this condition to be uncomfortable because, like, think about having that full feeling in your ear after you swim, but like all the time throughout your entire life. And this condition can predispose to ear infections and vertigo, and we think is a cause of dogs that are sometimes acting irritated around their ears and constantly kind of doing the scratching thing. Another thing I wanted to point out that hits close to home for me is the fact that brachycephalic dogs in general are at a huge risk of sleep apnea. I have sleep apnea, and trust me, it sucks. I have to wear a CPAP every single night. Otherwise, I choke in my sleep and I dream of drowning. I'm not joking. It's lovely. You ever see these dogs sleeping upright or falling asleep while they're standing up, or how loudly they snore? Well, everybody thinks this is some sort of endearing behavior, but folks, this is what an animal with sleep apnea looks like. And finally, brachycephalic dogs in general suffer from hypertension, aka elevated blood pressure, hypoxemia, aka low blood oxygen, and hypercoagulability, aka blood clots. These are all basically things that stem from struggling to get air and the stress response caused from that entire process. Again, lovely to think about. Oh, forgot about one more thing from the nervous system. Gliomas, which are basically malignant, uncurable brain cancers and are universally fatal. French Bulldogs are overrepresented along with other brachycephalic breeds for those tumors. Fun fact, I've seen a French Bulldog amass over $100,000 worth of hospital bills over the course of a calendar year, getting multiple brain surgeries for one of these. Yeah. Pretty terrible. I haven't even touched on issues like skin problems that arise from their skin folds, spontaneous elbow fractures just from moving around, hip dysplasia, eye issues. The list goes on, and this video is already long enough. So in conclusion, I do not believe it is fair for these dogs to continue making them in this way. I presented some evidence here, and there is tons more online, that the recipe for making these dogs, according to a contrived breed standard, puts them at risk for an abbreviated life of discomfort and immobility. Is it 100% of them? No. Is it way too large a percentage? Absolutely. But as I see it, I think there are three things required to make a change to make these dogs more healthy. One, as I've already pointed out, is the breed standard. We want to encourage less extreme features. Breed clubs in other countries have done this already following pressure from welfare groups, and I think those in the US should do the same. I don't think this will fix the problem, but I think it is a great place to start. Number two is the demand for these breeds needs to decrease. Nothing overpowers good old supply and demand, so if the demand for these extreme features decreases through client education, less extreme features will be made. It'll take time, but market forces like this are quite powerful and often the key to solving these types of problems. And number three, outcrossing needs to be encouraged as a means to reduce the extreme morphology of these dogs. French Bulldogs, like many other breeds, have a very high degree of inbreeding. Thus, trying to solve this problem within such a tight gene pool with no genetic diversity, really, is essentially impossible. You need to introduce genes from outside of this limited supply, i.e. from other types of dogs, to help with this. We should also encourage breeders who are not following the breed standard but are stringently testing and screening Frenchies for the things that medically affect them. Things like spinal imaging, BOAS grading, the Cheval 2 and chondrodystrophy screening. These are the problems that are claiming French Bulldog lives and costing their owners thousands of dollars. Not some arbitrary coat color or not having bat ears. I mean, come on, what is that? I hope you enjoyed this video. This is a video I've been wanting to make for a very long time. Again, as I mentioned in the beginning, please do not conflate the issues that I've brought up here with me hating on this dog or making fun of it or anything of the like, okay? My entire professional career has been spent training so that I could help them live more pain-free lives and walk again. I try to do this every time. They are lovely dogs. I totally, they're great dogs. Don't get me wrong. It's just that they have so many health problems that I think other veterinarians need to start speaking out, because we all say this behind the scenes, these issues that they have, we don't want to see them. And we think by and large that this problem needs to change somehow, some way. Leave a comment below. Let me know what you think or any thoughts and opinions on this matter. Hit like and subscribe, and I'll see you in the next video. Thanks a lot.